You know, the COVID-19 pandemic has generated an unprecedented spread of medical misinformation, which is exacerbated by the overwhelming amount of information accessible on social media, which can make it difficult for the public to discern what's trustworthy and what's not. As a layperson, I am one of those people who is always trying to get through and provide my family with the best information possible. So the idea of counteracting medical misinformation is relevant today, as it was 3 years ago when all of this really started. And it really was just about 3 years ago today when all of us started to become aware of what was going on, that there was a virus, that it was dangerous. And I think that just the dearth of it, there was not a lot of information. Nobody really did know what was going on. And I want to kind of take us back to 3 years ago and about what the world really looked like. I was one of those people that any piece of anything that came in my home was sanitized by Lysol and wiped down. And I didn't let family in my home, like people who are used to dropping by, like I was like, you have to go. Have you not read the newspaper? So there was a lot of not knowing. And so I feel like between social media and not knowing, it became a breeding ground for this virus. Within the US, more than 1 million deaths, 102 million COVID cases across the country, and death among Black and Brown people were 2 times were higher than with the general population. And according to the National Academy of Science, they estimate that more than 9 million families were impacted in some way. They are today grieving the loss of loved ones, brothers, grandparents, mothers, fathers, children. So, and I think we all can remember when the hospitals were just trying to figure out what was happening. And we remember the body bags, we remember the morgues being full. This is something like we had never seen before. So it was frightening then. I think it's still frightening today, but I think we're dealing with some different issues than we were dealing with 3 years ago, which really brings me to you, Dr. Arora. Because I do think there's a silver lining in all of this. There is a urgency and a creativity, and out of that comes your program. And I want to stick to the storytelling theme, and I'd like to hear your story of COVID and your realization of COVID, and then hear the origin story of the curriculum and the work that you all are doing in making sure that people can communicate and engage.
Thank you so much for having me here, and to the ABIM Foundation for hosting this event. And it's so wonderful to be here with our students as well. So I'm going to take you back because I got chills listening to you, Pamela, describe some of what was going on, because you mentioned 3 years, and I will never forget the day of the shelter in place that was put in the city of Chicago. It was March 30th of 2020, which is also the day that my son was born. So I went to the hospital and walked myself in, and I, was not, and I was wearing a mask and everything, and I wasn't, although I'm a hospitalist, I wasn't going to serve on the COVID unit like all my friends were. I was going to deliver my baby. And so I felt great guilt. I will be very honest with you. As a physician and somebody who works on the front line, I couldn't believe that I was, leaving my friends, to deal with this mess. And I was a hospital leader at the time. I did everything I could, but at the end of the day, biology is biology, and I was going to deliver this baby. And so I was like, oh, I'm going to miss out on the front line. And I literally counted the weeks that I was like, okay, China got back to normal in 12 weeks, guys. Okay, by the time I'm coming back from maternity leave, I'll be, in the game, and we'll be able to celebrate again. And quickly realized that wasn't going to happen. And what I also realized when I was on maternity leave, I was at home, and although I wasn't on the front line of the hospital, I was on a different front line, and I didn't realize it. But I am, obviously a mom, and already a mom to, an older daughter who was being, now I had to be at school at home and struggling with my other colleagues who were moms, and some of whom are on this call, shout out. And, so I was part of this. I wasn't part of the inside hospital community, but now I was part of my mom brigade. And we were literally just trying to survive, and at the same time help anyone we could who was in the hospital. And initially, all of the moms, many of them who are non-medical, were like, I'm dropping off cloth masks, I'm sewing, here's food, what can we do? And so our house sort of became this depot. And actually, our students don't even know this, but other students would come to our house and pick up boxes, and, we would, because they knew I was home, and deploy them into the hospital. And then, we all of us were on our doorsteps, because what else could we do? We couldn't go inside. And because I had the new baby, that was the excitement of the neighborhood. And I realized, sitting on my doorstep while neighbors would come by who were very well educated, that we had a problem, because they didn't believe this was necessary. They didn't believe people were dying. They didn't believe this was a problem. And they started to really question, well, why are we doing this? And that's when I realized, with this other group of moms that I was connected with, who were physician moms on social media through Physician Mommy Chicago, that is run by a friend of mine, also an internist, Laura Zimmerman, that we needed to do something. And so what could we do? Well, we could work with students. Some of them were college students and medical students in the area, and we could put out good information and try to address some of the myths that we were hearing. And that's how IMPACT came to be, Illinois Medical Professionals Action Collaborative Team. And so I did that, that was sort of I had a baby, but this was like my side project during my maternity leave, is to quell my guilt of the fact that I wasn't there. And so then I came back to work, in June, and I could just feel the burnout. It was so thick, and it was like the worst type of burnout I have ever experienced. And I know I missed out, and I was like, well, what can I do? What can I possibly do to help people? And I attended a grand rounds given by Dr. Peter Hotez, who many of you know is a
yes,
famous researcher and a vaccine, scientist, helping vaccinate the world. And he gave our Department of Medicine grand rounds. And he said, I felt like he was speaking to me, that, medical schools need to get in the game and start teaching about this, because this is a problem and it's not going away, and it didn't come from COVID. It's all been here. And he connected the dots, and he connected the fact that, the myths about infertility didn't just come overnight, but they have been persisting, and there's sort of a disinformation engine here. And at the same time, the Surgeon General issued like a warning, the misinformation is a public health crisis. And in that, he said health professional schools need to be doing this. And I thought, yes, we need to be doing it. And I felt somewhat empowered in the sense that we had some local experience with, I know Dr. Bloomgarden is here, some, people who wanted to do this, who are part of our network here in, that had helped me in the community. And I thought, well, and we also had a need, which is a lot of, even though medical schools were getting back to normal and bringing people back to class, we weren't at the point where we were ready to offer, shadowing in the ER, like that wasn't still allowed,
right.
and so we had to fill a need with a course. We needed some courses to fill some needs in our curriculum. And I thought, okay, this is an opportunity, we can, answer this call and fill a need, and perhaps the first cohort of students will want to help do this. And you don't know how it's gonna go, but I'm pleased to say Dr. Bloomgarden's one of our professors who's here with us. We also have a science communicator, journalist, Sarah Saratella, who joins us as a co-instructor, and she had a lot of experience teaching about this in the college. And so with that local expertise, we have sort of shown what's possible, and so it's been really amazing to see.
I really like the way that students have become a part of this work. And it sort of reminds me of how, so I'm going to show my age. So it reminds me of the civil rights movement. Those folks who were on the front line in civil rights work were young. They were students, and they were at the forefront. They were ready to make a change. They were there. They were available. Was that what you had in mind, Vinny? Like Dr. Arora, I prefer to call you. Is that was that what you were trying to do? Were you trying to find a way then also to engage students? Because a lot of the misinformation was being spread in that community, an important community. Was that what you had in mind?
Yeah, I mean, well, I've always been of the opinion that our students are not blank slates. They come to us with lived experience and they can provide so much value. And I think you're going to hear from them about how our students, I mean, we're talking just here about how students address misinformation. I should tell you, Pritzker has been honored with awards for how many students rose to the call, literally to address the needs of our local community during COVID. And so it's our students are not just here to learn. They are part of the fabric of our community, and they help keep things going. And so I think that's something that is really kind of impressive to see. And then the other thing I should add is, we, and this sort of, I think, dovetails in with Naomi's story, which is that we were getting calls from the library. So one of our librarians is here, Deb Warner. So shout out, and public librarians, Chicago public libraries, to say, we are being asked questions, we need help, and so people were leaning on us, and we had started this, it's interesting. There's misinformation that you see on the public social media that I'm telling you about. I also was dealing with uncertainty in the hospital. Like the first few questions people were asking in the COVID unit were, my wife is pregnant, is it okay if I work here? People had very personal questions they were bringing into us. Those are employee safety questions. Right. And so we had started this COVID educational support team to ask questions with our librarians that we would give you as soon as we could give you the question. And that's really when this idea got to be born of, well, how can we help even clinicians get information quickly, right, and visually, that they can then, deliver to patients. And so with that, I'll just pause there, because I think others can fill in the details.
It does. It beautifully brings us to Naomi, and you got a call. And so I don't know if that's your personal story, but I'm happy to hear how you felt when you got the call, or when you saw that, I guess there was an advertisement. Why don't you share with us your journey in this work, and maybe you can share a little bit what was going on in your neighborhood and your life when COVID first started.
Yeah, of course. So to sort of pick off where Dr. Arora left off, when COVID first hit in 2020, I was recently accepted into medical schools and very excited to see what second look or come back to the schools that I had been expected to. But then all those opportunities sort of had to fall back for a bit just because of the environment we were in. So I was at home and I was getting a lot of the information about the schools online. And Pritzker really stood out to me because the students were so engaging and reached out via Zoom, email, text, FaceTime. And so that really resonated with me. So when I moved to Chicago in August of 2020 and I started medical school, I knew that I was coming into a community that was very supportive and also very much in tune into what was going on in the world and how this was impacting our communities. And so when I was home during COVID, I was just like everyone else, getting the news of what's going on. And, I also was learning myself. I hadn't started medical school yet, so I had no idea what was going on in terms of the frontline worker point of view, but my mom is a medical assistant. And so she actually was one of the first people who helped out with COVID testing very early on. So I got to see a bit of that. And then when I started medical school, I was, very eager to sort of get involved in the Chicago community and learn more about where I had moved to, since I moved from Atlanta, Georgia. And obviously doing that online had some limitations. So by the end of my first couple of months of med school, I heard from a fellow older student that there was an opportunity for medical students who had experience in visual art or had hobbies somewhere along the visual art spectrum to help out with the infographics, because the vaccines were about to come out. There was a lot of excitement with that. And so I thought this was a perfect opportunity for me, because when I was in college, I sort of developed an interest in graphic design, and I lended those skills to the various organizations that I was involved in, but it was never more than just a hobby and a way for me to learn. And so I thought that this would be a great opportunity to sort of bring what I had experience in and bring it into this very impactful way, because as a first year medical student, I was a bit far removed from my clinical rotations, and I didn't yet have the credentials or the knowledge to help out directly as a first line responder, but I thought that this would be really helpful. And
But
so I
yeah,
met with the team, and then from there we went.
but in fact, you were sort of like a first line responder in a different way, right?
Yeah.
Um, so you got a call for graphic artists. You thought,
Mhm.
let me. So why infographics? Why infographics? What was the reasoning behind it? Did you understand why they thought that this was a good way to start trying to communicate and engage better with the community?
Yeah, so when I got the call, it was that the whole goal was to help inform the community. And knowing that for, I think by this point, like 8 months, a lot of us had been getting our information online and through graphics. And, people were already used to this. In fact, when I was in college, I took a social communications class and we learned about infographics. So the fact that we were using infographics seemed very natural to me, especially knowing that the history that it's had in the health world as
Mhm.
well. And so I think the appeal was, one, to reach a large amount of people, and two, to do so efficiently because we're getting information so fast. And even before the vaccines had come out, there had already been talk about conspiracies or various myths surrounding it. So we knew we had to tackle this efficiently.
Right. And of course, and I'd like to ask Nick, who is on standby, if you could put up one of Naomi's creations, that would be great. And once that gets up, Naomi, I'd like to ask you, tell me this infographic as a tool, what makes this easy to engage? What were the things
Mhm.
that you were trying to convey in this infographic?
Yeah, so when I met with the team, I worked closely with Dr. Roses, who was a hospitalist here at UChicago. And so what he really wanted to stress to me is that the theme, if there was going to be one word to break down what we want this infographic to convey, it's safety. Because obviously with the news sort of making this seem like a new vaccine coming out, people had a lot of questions about what that would mean for them and for their health. And so we went over the New England Journal of Medicine article that published the clinical trials. And
Mhm.
so he helped me kind of read over it. And from there, we actually chose an infographic that focused on background, methods, results, limitations, and conclusions, which was very similar to how the New England Journal of Medicine sort of broke down, or that article broke down the information. And what was unique about this is that I came into this thinking that I was going to make infographics for non-healthcare workers, or, like
Mhm.
the general public, as we call it. But Dr. Rosa's, he reminded me, like, this is new for healthcare workers as well. So we're going to make two different types of infographics. So the one you see is for healthcare workers. So that's why we chose to do what we describe as a one-pager journal summary. So it has the background, methods, results, limitations, conclusions format that a lot of healthcare workers are very familiar with, but we wanted to make it easy to digest. So that's why we sort of went for the visuals that we went for under background and then methods as well. And we also wanted to show that it was a randomized controlled trial. So that's why you see how the participants were sort of divided up into the Pfizer and placebo. And then again, with the results, we wanted to focus on safety and efficacy. So that's why we went and chose the results that best conveyed that, and then went over the limitations and the conclusions that a healthcare worker could draw. And the goal of this was that a healthcare worker could sort of look over this information and then be able to um, convey it during the clinic appointment, for example.
I think
I want to
it's an incredible way to distill information. And I just glancing at it is so informative, Naomi. You did a beautiful job. And Dr. Aurora?
Yeah, I just wanted to remind people that at the time that we were recruiting Naomi to the team, the vaccines were not available to the general public. They were available only to healthcare workers. But in anticipation for vaccine hesitancy that we had already heard about from our community, and in the south side of Chicago, many of our healthcare workers come from the neighborhood or very close to live in Indiana. There is already some distrust of the healthcare system there, even among healthcare workers. So our institution had gone on to this realization that we needed to do an internal campaign first to really boost the vaccine confidence of our own workers. And so that was where we deployed Naomi's skills first. And we had also another student, and I want to shout out to Caitlin Van Kempen also on the call, who's from the library. We had another student who was also helping with the public. So it was like a twofold campaign, but the work on the healthcare workers was seen as urgent, because I want to remind everybody that for healthcare workers that didn't get vaccinated, right, that was an urgent problem for us while they were still being exposed chronically to COVID. And with Naomi's work and a lot of other people's work, including our urban health initiative and town halls and this proactive approach, we had a very high vaccination rate. And so even to the point where other hospitals have called us to say, how did you get this rate? And so we weren't in this position of like, you do hear about people being like, oh, thousands were let go because of the vaccine mandate in healthcare. We did not have that. And so, but we didn't have that because we planned for it. And we worked really hard to, with frontline healthcare workers and our students, to really do the campaigning inside and gain that trust first. And so for some of the folks who are wondering like, oh, this looks more scientific, we wanted to highlight that we were appealing to a scientific audience, but also wanting to get information out in a way that was digestible.
The one thing that I want to point out is Dr. Arora is doing a lot of shout outs. And I think mostly it's because there were a lot of people involved in this effort. This was a community effort. People got involved and people, gave their talents to where they could, whether it was creation, whether it was art, whether it was science. People were it was a great community effort. And I really want you to know, I appreciate that you're doing the shout outs. I want to go to you, Maeson, because you also are an artist and a medical student. And so you have interest in both. And I'm just interested in the idea of being courageous in a time where no one knows what's up, what's down, what's left or right. There's a lot of confusion. Tell me a little bit about where you were in this process and how you came to this work and to this class.
Yeah, for sure. For me, I'm a year behind Naomi. So I'm a second year medical student now. I was a first year medical student last year when I was presented with the opportunity to take a course offered for combating medical misinformation. And that really spoke to me because it seemed like a very tangible way to create change with the level of experience and skill that I currently have. I think a lot of people want to go into medicine in part because they feel like it's an avenue to change, whether that's for a single person's healthcare or their surrounding community or hospital policy. But as a first year student, although that's like an overarching goal, it's sometimes hard to figure out avenues that you can personally do that, especially when you have classes and all the other activities and you're getting used to medicine and the community, a new community in a new city, et cetera. So when I was presented with this, I felt very compelled to kind of take advantage of this because I hadn't heard about this sort of opportunity being available from my other friends at different schools or just in larger conversations with other people in the medical field. And I thought it was really important given the climate of seeing so much misinformation online, but also as a way to show that students can make these sort of changes at any point and that you don't have to be like have an MD or have certain letters behind your name in order to kind of take a step into this and put yourself out there and say like, hey, these are the facts, or this is what we know so far, especially in times where it's kind of like a gray area and can breed misinformation.
It's an important, it's very interesting that like students being engaged in this and being able to become leaders from where they are. You don't have to be at the top of an organization or somewhere in the hierarchy that makes you a leader, that you actually become a leader. I'm interested because I understand, because I'm also the Senior Vice President of Communications here at ABIM, infographics take a long time, right? There are a lot of considerations. How did you prioritize what was important? What was important to pursue? So we know that there was a vaccine information, but tell me a little bit about how you all prioritized what infographics to do and why it was important to concentrate in that area.
I think in my experience in this class, our class tackled a diversity of different topics, and a lot of them were drawn from personal experience of what they had heard in their own communities or families and what was affecting the people around them. So I think if you're hearing something repeatedly from the people around you and you're wondering like, hey, is this correct? Or like, what's the backing behind this? And you feel that it is important, then it's definitely important enough to tackle. And when you're doing an infographic, you have such a limited like space. So you really want to get to the core of the issue. Like, what is the myth that people are saying? What is the fear that's driving them to say this, or the concern, or whatever it is? And kind of like, what are the 1 to 2 to 5 like quick things that you can kind of say like to combat that, right? And it has to be in a format that people can read it, understand it easily, you know, when they're scrolling on their phone and they see it in an Instagram post, that doesn't take them half an hour to go through it. And there's different levels of how you can do that. But I would say one of the appealing things about infographics is that it is very accessible and it's easy to make changes. So if there are times where information is coming out, you can go back to the original infographic you have and change a few things. You can update something really quickly on social media. You don't need to write a whole paper and publish it, or write an entire article and publish it. And that's kind of like the beauty of it. And Naomi can probably talk more about Canva and some of the other resources that are just widely available to take advantage of for people to kind of get started if they want to with relative ease.
I would like to get to Canva in just a moment, because I think it's really important what you're trying to do, whether it's infographics or videos or op-ed pieces. You know, Dr. Arora, to say what is the truth is it's very difficult. And I talked to like at least 5 people before coming to this interview, just trying to see, and well-educated people, but how do you think this misinformation, disinformation, medical myths, whatever you want to call it, how do you think you're doing? How do you think we're doing as a community?
Well, I should start by saying, education is one tool, right? There are many other tools out there. And is this going to be the only tool that battles disinformation? Absolutely not. And we've written about other things that need to happen, and social media and policies, et cetera. And I know that like, Rich Barron and others, at ABIM have as well. And so I would say this is a way to empower clinicians. And what we have seen actually, and this is my shout out to the AAMC and the CDC, which funds our work now, because we started dabbling, and then with that early work, answered the call for, grant proposals and schools that were doing this. And we're like, hey, we're doing this. And then take it to a new population. And so with Naomi and Maeson, we were like, okay, let's take this to nurses and pharmacists and frontline healthcare workers, because again, that's sort of my identity, which is like, how do we give back to them? And they, at that point, now that it's like further along in the pandemic, the burnout is being perpetuated to the point where at least some, unpublished data that I've seen shows that if you're burned out, you're less likely to counsel about COVID at all, because you're just like, I can't deal with it anymore. And I myself face this, like, when I'm on service, I know seeing the comments that it's hard to talk about vaccines. It's hard to do the missed opportunity with every hospitalized patient and, build trust. I mean, I'm not even a primary care doctor, but I go in and trying to be as empathic as possible using the techniques that Sarah and others teach us about storytelling and, kind of finding that common ground and asking the why. And I may not get to a yes that day, but maybe in a few months I'll see that I get to a yes. And so the key is to empower our frontline clinicians with the hope that we can do better while we also pull other levers, and so with that, I think that at least our experience with working with frontline clinicians these are tools they can operationalize at the point of care. And what's been interesting is that it's not just so the infographic is a tool, but sort of it's really the art of reaching people using plain language. And that's something, as somebody who for 10 years taught students research. I mean, my goal was research training, right? I would teach students how to get up and talk to scientific communities, right? And I realized we have never, as a medical schools nationwide or health professional schools, we have never adopted let's train our clinicians to talk to the public. We talk about, individual patient interactions, but that's going to take a long time. And now as we see people on the radio and TV, newspapers, and so that's what we're really trying to do here with our next rendition is empower students and clinicians to actually take these skills and reach the public. And I know that Naomi and Maeson can probably talk a little bit about examples there.
Yeah, I'd love to hear some examples about Canva, how it works, and how other people can think about utilizing it as a way of creating their own infographics and getting to explain and engage with patients and with other physicians about what is happening in the COVID space and in medical misinformation just generally. Naomi.
Yeah, I can speak to that. So there's a lot of different sort of graphic design tools out there, especially if you want to start off making it online. But what I liked about Canva is that it was free and it's very user friendly. And so I think the appeal of it is that, sometimes people think, oh, I don't have any art skills. I don't really consider myself particularly artistic, but it's okay because with this sort of tool, they have templates that sort of give you ideas of what looks good and what will appeal to people, especially in this day and age, and making sure that it's up to date. So I think once you have an idea of what you want your infographic to convey and sort of the language that you're thinking of, I think it's a great tool to sort of start thinking about, okay, like what colors, what word am I going to emphasize? Which word am I going to make bold or bigger, etc. And so I think that's excellent. I also think that like the CDC, World Health Organization, I also refer to impact infographics a lot. Like I said, infographics is used a lot in the health world, especially in the domain of public health. And that's where I found the best sort of guides to make infographics and reach audiences that are both very well versed into science and science terms and those who aren't. So those are some of the pros of Canva that I found helpful for this project.
So we talked about infographics and we actually showed your infographic, but Maeson, you worked on an op-ed piece and I'd like to hear, I think we'd all like to hear more about that.
Yeah, so I was just, I worked on, as part of the health policy interest group, student leader for our Pritzker community. And through that, we have a health policy review that we publish twice a year that enables and empowers students to kind of write their own op-eds and able to have a platform to publish it and make sure that they do get their word out and are able to have that avenue. A lot of my class was able to publish in other places as well, including the Chicago Tribune. Kevin MD, one of my classmates, was interviewed based off of his work that he did on the FDA blood ban for men who have sex with men. And so it really kind of inspired having this op-ed avenue to writing, as well as training in how to write op-eds, where you can publish op-eds that Dr. Arora was a part of this previous year that we piloted at Pritzker. We were able to kind of create these different pathways to advocacy that don't solely rely on infographics if that's not what you're passionate about or where your skills lie. And I think that just kind of goes to show that there are a lot of different ways to combat misinformation. And again, this is at a student level. And so you can, if your skills lie more in writing or like persuasive editing or whatever, you can team up with other people to write an op-ed. You can write one on your own and find places to get that published. You can do the infographics. I did my infographic for our class not on Canva because I had experience with other software like Procreate, but you can use Photoshop if you are a photographer and have experience with that. You can use just all sorts of like different, you can use your notes app on your phone and draw a comic and screenshot it and post it to your Instagram story. Like it doesn't need to be an intensive skill, high barrier of entry task, and it should cater to what you are able to do with your current skills and time and energy. And I think people see this as like an enormous barrier to entry to kind of put out this sort of like, I need to go and be the huge advocate and come up with this infographic that I have no idea where to start, when maybe they like have a background in English and could write an op-ed in a night and get it edited the next day. So I think it's important to have those different avenues in order for people to take advantage of what they already know they can do.
Thank you, Maeson. I'm just curious because we do have to go to Q&A, but I am curious about the op-ed work, Dr. Arora, because, sometimes it's about not just about information, like infographic is about data and just kind of making sure that you share that in a way that, but when you start getting to op-eds, there's tone and there's all of the other things. How did you work with students to make sure that they could express their ideas in a way that people could hear it?
Yeah, so this is really about, so it's interesting, like Pamela, you asked us to start with stories, right? And this is where I would say that we approach everything like a science, right? In medicine, except for the way we talk to people. We don't approach that as a science. And there is a science to getting memories to stick and the whole neurobiology to it, and especially in these days where, they say that, humans have a memory of less than a attention span less than goldfish,
Right.
So, right. And so how do you, there's a reason disinformation spreads so fast online, because it can use the power of emotion and story, right? And in order to counter that, right, it's not going to be like me with my poster and, my paper, right? I have a lot of great friends, not in healthcare, who got me onto social media by saying, nobody's going to be able to even access your paper. You need to be able to talk about your work. And I think that what we're finding is that whether it's an infographic or an op-ed, there is a science to teaching people how to communicate. And so that's why I have to say, I can't do this work alone. We work with science communicators. There is there's expertise there. And working with our science communicator, Sarah Saratella, she talks about the art of the story, right? And the element of surprise. And so really playing into your lived experience. And so that's why many of our students, we always say, lead from where you stand, right? So, some of our students writing op-eds will say, well, am I the right person to address X, Y, and Z in healthcare? And what I'll say is, well, you're not coming out there like as dean for med ed. Here's what I'm saying, right? You're going to come out there as a student from Atlanta, here's what I heard in my community, right? And as a medical student now learning this, here's what I know, right? And so it's setting up that tension. And then setting up that expertise,
Right.
And so so we have Dr. Bloomgarden, who helps us with the infographic course, along with our librarians, as well as Sarah Saratella. On the flip side, for the op-eds, we have two faculty who help us teach this, Dr. Krishnamurti and Dr. Jane, who both have received op-ed training and have written a ton of op-eds, who can then, along with me, proof op-eds and say, are you leading from where you're standing? And then also, what's your call to action? And so that, because remember, to place op-eds in this day and age, the fact that we can say so many students have published op-eds when there's like a flurry of things coming at you is pretty impressive. And similarly, to say that infographics carry some traction when there's so much stuff released every day, you've got to be able to capture the attention of your audience. And I want to say to the science purists out there that, we have to use science to communicate science, right? And so that's really the goal, is that we're not making shortcuts. We're actually like going the extra mile. We're going that last mile to translate that paper that we published all the way down to so somebody like my parents could understand it, And I mean, even last night I got a call from my dad who's like, I saw this online. Is this true? And I'm like, no, it's not true. But tell me where you heard it and tell me why you believe that. And then let me, so it's like, tell me first and tell me why you believe that. Because usually it's that something, people have heard something that connects with some other piece of information. And for example, in this case, it's, let's say you're worried about COVID and heart attacks, right? And then you're like, well, I heard this and my friend had a heart attack and he just had the vaccine. So then you're like, okay, I now understand where you're coming from. So now let me explain that heart attacks have been happening all the time. And this is why this has happened. And it's really the why. If you can get to the why, people will then believe it. And then they can actually also debunk it to somebody else, right? And so that's really the goal, is to not just say the vaccine is safe,
Right. We all need a daughter that we can call and ask that question.
Yeah, right. I agree. We all would, right?
So I'm getting tugged here because we do have quite a few questions in the queue and we want to get to them. So Daniel, I'm going to turn that over to you.
Thank you. And this has been an incredible conversation. Thank all of you. Thank you, Pamela, Vinny, Naomi, and Maeson. There's been questions about change of information. We get updated information about vaccines and change of focus. Now we're on vaccines. It could be MMR next week, or it seems to be now. So how do you adjust to some of those changes of information and changes in focus? I saw two questions that related to that, and I'm putting it into one question.
Well, I'll start and just say briefly, we teach in the course, as our students will attest to, that science is changing, it is evolving. And that's one of the reasons for the distrust. And so it's important to list your references to acknowledge that based on the facts that we know now, this is the case. And that way, there's always this concept of the fact that something tomorrow could change the way we think today. But we're giving you the best information that we have today. And then around the vaccines, I will say, if you look through the infographics and some of the work, and especially I'll reference Dr. Hotez, the myths are some of the things that they're addressing are the same. And so vaccine confidence as in general is going down, in part because of the issues with the infodemic around COVID. And that's why education is powerful, because it's about teaching techniques, and then you can apply those techniques multiple times over. So we just got our, working on getting our grant renewed from AAMC to now take this work to residents who are working in the community, to residents from all fields. And so again, whenever we teach a resident in a different field, or a nurse or a physician, they pick something that matters to them. And usually it's very hyper-focused to their area.
And, we know some of the limitations of education. Is there any thought to build some other strategies that the students can use to combat and mitigate misinformation beyond the education? One, I think, is the op-ed. But
yeah, I'm going to defer that to our students, because I know these two have talked to me about this, but I've also, had expert conversations with other people. So I'll defer to these guys.
Sure, I can start off. I mean, the op-eds are the Pritzker Health Policy Group isn't a course at Pritzker. It's like a student or run organization. So this is like a call to any students at any school or program that they can kind of get together. And if there's enough interest and you need a handful of people, you can kind of create your own organization around whatever sort of advocacy or combating misinformation that you want. Like the op-eds, the health policy group has always had the Pritzker Health Policy Review, which is where they publish the op-eds, which just shows that combating misinformation and combating misinformation has existed a long time before COVID. And now that there's this spotlight on it, it just provides more opportunity to develop like orgs like this, or to develop different ways to kind of branch out beyond that.
Yeah, and just to add to that, I've seen my classmates, they've used avenues such as mentorship, reaching out to high school students and college students, and using these sort of pipeline programs to also sort of teach these techniques and use these methods to combat misinformation. So it can truly be in ways that are already established.
Okay, the next question I have to ask, and how do you address the historical lack of trust? Also a lot of thank yous in the chat, by the way, and congratulations. So I wanted to point that out. But it gets back to another question that person asked is, how do you field test some of your messages with specific populations?
I'm happy to go first, and then feel free to jump in. We have to acknowledge that we have not been trustworthy. That's just, we have to put that out there. And there are going to be groups that have high distrust of the healthcare system. I watched in a ethics seminar yesterday, very powerful. I rewatched Dr. Susan Moore's call for help while she was hospitalized at a hospital, a Black woman physician. And it was heartbreaking, and she went on to die. And she said, like, this is how Black people died. It was horrific. And we need to come to terms with the fact that we need to do better, and so I think that we have to lead with that acknowledgement, that things have not gone well. And so when I see my patients in the hospital and they are there for diabetic foot amputation, right? Like, what are the things that led to that, And some of them, in the old days, we might say, oh, they were non-compliant. That's not going to fly anymore. Like, that's not, what have we done to fail that patient, right? So that they are there, and this is where we've come. And so I think we need to recognize that we need to earn the trust. And if we lead from that we need to earn the trust, then the answer also is, I have a patient who I would talk to about COVID vaccines all the time. And he's like, I know this is your thing, but, I'll listen, but I'm not going to get vaccinated. And I said, okay, tell me what you want to talk about. And we switched to talk about what he wanted to talk about. And then, interestingly, a lot of my patients who know me well don't have good primary care, so they come in and out a lot. So I meet them, also a distrustful thing, but they trust me now because they see me a lot. And he said, okay, I know you're here to talk about COVID vaccine. I don't know, I'm here to talk about what you want to talk about. And so I think that's the other thing, is we've got to make space to connect with our patients, and our healthcare system has to help us do that. I know our students learn a lot about health equity and anti-racism as well. So feel free to volunteer other strategies as well.
The word compliance and adherence in my day used to be the words, and now they're not so the words that we need to use. Do you want to add on to that, Maeson and Naomi?
Yeah, I was going to say, I think it's so important to, especially if you're trying to reach out to a certain community, to make sure that you have a voice as a community member, be involved in your messaging. I think I've seen this best illustrated recently when I was working in a clinic with patients who are predominantly Spanish speaking, and seeing a classmate of mine who identified with the community and being able to use their skills, and just seeing patients look so happy when someone who speaks their language is able to communicate with them. And another avenue I've seen this also is with American Sign Language, being able to sort of get the input of people who are like, hey, I'm part of this community and I know these are the best ways to reach out to community members. And along with Dr. Arora, with what Dr. Arora said about acknowledging the systemic and institutional level inequities we have. And, you know, it's hard to sort of take ownership of that as one healthcare worker, even as a medical student, but acknowledging that and, you know, sort of coming to people like, you have a right to be distrustful. I think that I've seen conversations that start with that be very transformative.
So another question was about how accepting are the hospital staff about this infographics messaging, and how have they been helpful or maybe a barrier to what you wanted to do?
I'm going to let Naomi answer that because she teaches in the course to our pharmacists and nurses.
Yeah, so I'd say in my experience, it's been vastly positive with the house staff and their willingness to take on this type of initiative and this type of work. I personally haven't really seen any pushback, just aside from perhaps like, oh, like the wording or like the approach per se, but the bigger picture of reaching out to community members using the avenues we're talking about has been overwhelmingly positive.
So going once, going twice, if you have any more questions, please put them in chat. But I think I've covered a lot of them. If I haven't, please put them in again and I'll get to them. But I think I've hit on a lot of your questions, but let's not me assume that.
And I can add that we do have a lot of references that, you know, probably too many to inundate with the chat, but we'll pass along to the ABIM Foundation team to share.
Daniel, I do have a question while we're waiting
Okay,
for
thank
additional
you, Pamela.
questions. Yeah, I just wanted to, I think Naomi got to it a little bit, is just like people and how they come to a decision and what they believe is very emotionally charged. And even more so, I think it's just growing more and more difficult to have these conversations. And this is for either Naomi, Maeson, or Dr. Arora, you know, how, whether it's a video, whether it's an op-ed, whether it's the infographic, how do you meet the patient? How do you meet the clinicians? How do you meet people where they are? Because there is so much emotion. And when people get emotional, they stop thinking, right? So how do you open up the conversation?
I can kind of start with my experience. Anytime I've had kind of difficult conversations, whether that's with family members or patients or just community members, I feel like coming into it with the idea that you have to meet them where they are, and the fact that you might not change their mind in one session is really important. Like, you're not going to make somebody do a 180, or you're rarely going to make somebody do a 180 on where they stand. But if you can present things calmly and kindly and compassionately, and then people go home and they look stuff up and they have like this seed in the back of their mind that's like, well, I was told this, right? Like, the information is there. And if it's done in a compassionate and kind way that is also easily understandable and clear, then oftentimes after, you know, repeated instances of this, or they will talk to somebody else about this conversation that they had now, and they have additional information, they'll end up like slowly coming over to a middle ground, or at least have more of a, they'll have to analyze more of the reasons why they may or may not be making a certain decision. So at the very least, hopefully people are more informed.
That's great. I wanted to ask, do you have another question, Daniel?
No, I want to wrap it up. It's 2 minutes of
No.
Pamela. And so I just want to say a quote from the chat that I think sums up the session. Amazing work. And this session re-energizes and is relevant now that COVID vaccine may soon become annual, like flu vaccine. So great. We'll get you these chats, but a lot of appreciation for this discussion, particularly about just the relationship of this and mistrust and our work in mistrust and building trust. So I'm so sorry, Pamela. I always cut you off and it's just a bad habit of mine, but we have 1 more minute. And
I just want to, yeah, we have 1 more minute.
Yes, but please.
I just wanted to wrap it up by thanking Maeson, Naomi, and Dr. Arora. Their work is incredible. It will change a piece of the world, in the right piece of world where you have made this commitment and are engaging and trying to make sure that people, not everybody has access to physicians. So the idea that you can reach out and engage, I think is so important. And I just want to laud your, just as Carolyn Hiller says, your excellent, excellent work. Thank you so much. And thank you for being our guest today.